so today my teaching is for a school-age child, and it's about childhood leukemia. I have some resources for her that I'm providing her with, and it'll go off the lesson that I'm teaching her. So I'm just going to start off with the introduction, which is talking about what it is, and then we'll go more in depth and about the signs and symptoms and stuff like that. So the most important teaching for this child is because ALL, which is acute lymphoblastic leukemia, is the most common cancer in children, adolescents, and young adults younger than 20 years old. And then, so going more in depth about the background of leukemia, leukemia is a type of cancer that can affect both adults and children. It's the most common cancer found in children younger than 15 years old, with 2,500 to 3,000 new cases in the U.S. each year. ALL, which is the acute lymphoblastic leukemia, is slightly more common among Hispanic and white children than among African American and Asian American children, and it is more common in boys than girls. Leukemia is a cancer of the blood and the bone marrow. In result of the altered genetic makeup of white blood cells, they form immature cells called blast cells in the bone marrow. Since leukemia affects the bone marrow, it decreases the number of red blood cells, causing anemia and platelets, which can cause excessive bleeding with minor cuts. Also, the patients are more prone to infections because of the altered genetic makeup of the white blood cells. Some of the most common manifestations of leukemia include fever, pallor, bruising, petechiae, excessive bleeding, joint pain in their knees and legs, abnormal white blood cell counts, anemia, weakness, infections, inflammation, malaise, and fatigue. So now I'm going to talk about some diagnostic studies and the treatment that they have for leukemia. There are a couple of tests that can be performed to diagnose the patient with leukemia. The easiest is a complete blood count and a history of the signs and symptoms and how long the symptoms have lasted. To confirm leukemia, they aspirate a sample of the bone marrow for a biopsy. Another test is the flow cytometry, which uses a laser beam to analyze the bone marrow sample. This test is able to diagnose the type of leukemia within hours of the test. For the treatment of ALL, which again is the acute lymphoblastic leukemia, they use 3 different techniques, including induction, consolidation, and maintenance. For the first phase, induction, the goal is to get the patient into remission, which remission is the reduction of immature blast cells in the bone marrow for leukemia. With remission, the hope is to get the blast cells down to less than 5%. If there is more than 5%, the prognosis is worse. Approximately 98% of children with ALL achieve remission within 1 month. Remission can be measured 28 days after chemotherapy was started by lumbar punctures and bone marrow aspirations. The goal of the second phase, consolidation, is to maintain remission and prevent any diseases. Lastly, the goal of the third phase, maintenance, is to administer lower doses of chemotherapy for 2 to 3 years to stay in remission and to prevent leukemia from reoccurring. Do you guys have any questions? No. Okay. And so to evaluate the teaching, I'm using Jeopardy as a mini quiz to test what they learned from that lesson. So we're going to start with Madison because she's the youngest and she's what this teaching was for. So go ahead and choose from any of the categories.
All about 100.
All about 100, okay. So your question is, what is the most common cancer in kids younger than 15 years old?
Leukemia.
Perfect. So then you get 100 points. Alrighty. Hunter?
Treatment 100.
Treatment 100. Your question is, what are the 3 techniques used for the treatment of leukemia?
Maintenance. Containment.
You are incorrect. So Madison, do you want to go ahead and steal that? Do you know the answers?
No.
No? Okay, so no one gets that one. Okay, so we'll start with Madison. 200, okay? Your question is, when can remission be measured after chemotherapy?
What was the question?
Okay. When can remission be measured after chemotherapy? You don't know? Okay, Hunter, you want to steal it?
28 days.
Good job. So you get 200. Okay. So now, Hunter, you get to choose.
Random 300.
Random 300. What is the percentage of blast cells for a hopeful remission?
5%.
More than or less than?
Less than 5%.
Okay. You get 300. All right, Madison, go ahead and choose.
All about 200.
All about 200. What is leukemia the cancer of?
Blood and bone marrow.
Mm-hmm, good. So you get 200. Alrighty, Hunter.
Symptoms and signs 100.
Okay. What are 3 signs and symptoms of leukemia?
Fever. Tiredness.
What?
I don't know.
Madison, do you want to steal it?
Infections.
Mm-hmm.
Tiredness.
Yep, fatigue.
Fever.
Yep. Okay, so you get 100 points. All right, now you get to choose since he chose that one.
Random 100.
Random 100. What is the race most likely to have ALL?
Hispanic and white children.
Yep, perfect. Okay, Hunter.
Signs and symptoms 200.
Okay. What are patients with leukemia prone to because of their abnormal white blood cells?
Infection.
Mm-hmm. Good job. Okay.
Treatment 200.
Treatment for 200. What is remission for leukemia?
What was the question?
What is remission for leukemia?
A reduction of immature blast.
Mm-hmm. Blast cells in the bone marrow. Perfect. So you get 200. Alrighty. Hunter, go ahead.
Treatment 300.
Treatment for 300. What is the maintenance phase of treatment for leukemia?
Containing the leukemia.
Would you like to steal?
What was the question?
Question was, what is the maintenance phase of treatment for leukemia?
What category?
Treatment.
Induction. Consultation. And maintenance.
No. Okay, so nobody gets the 300. Okay, so then your turn.
All about 300.
All about 300. What does ALL stand for?
Acute lymphoblastic and leukemia.
Perfect. So you get 300. All right, Hunter. Last but not least,
Signs and symptoms, 300.
perfect. What are effects of decreased red blood cells and platelets? No. Would you like to steal?
Go for it, Madison.
It was for signs and symptoms, 300. Question was, what are effects of decreased red blood cells and platelets? You don't know? Okay, let's see. Let's tally up the points really quick. So, Hunter, you had 500. Madison, you had 1,000. Okay, well, Madison won. So with this teaching, it showed that she learned some knowledge because she did beat her older brother. And